Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Right. Now we have Morgagni hernia, which is also called as retrosternal hernia, which is also called as Larrey's hernia. So in Morgagni hernia or retrosternal hernia or Larrey's hernia, here it is actually a congenital hernia. Here the mainly there is anteromedial or retrosternal diaphragm is defective. So here there is defect is present in the, here you will see defect is present in the anteromedial or retrosternal diaphragm. So this mainly occurs in a triangular space between the muscle fibers that make up the diaphragm. So the site of the Morgagni hernia is in the triangle, is present as a triangular space between the muscle fibers of diaphragm. So over there we see this Morgagni's hernia. In 90% of the cases, Morgagni's hernia is right-sided. Why? Because what is present on the left side preventing Morgagni's hernia? Because pericardium is present or mediastinum is present, which will prevent the left-sided hernias in Morgagnian hernias. Then through the Morgagnian space, the superior epigastric vessels passes through the Morgagnian space. This is one important factor. Then, if you see the most common involved viscus in the Morgagnian hernia is transverse colon is the most commonly involved viscus in the Morgagnian hernia. Usually, the patients with Morgagnian hernia are asymptomatic and anterior, and if you do an X-ray is done, especially the chest X-ray is done for the diagnosis of Morgagnian hernia. On the chest X-ray, we see presence of anterior mediastinal masses are seen on the chest X-ray. Then, if you see the treatment of the Morgagnian hernia, for the treatment of Morgagnian hernia, we should do a surgical repair. Prompt surgical repair is done for the Morgagnian hernia, and this surgical repair is done. First, the aim of the surgical repair is mainly to avoid the incarceration or strangulation of the abdominal organs, because the abdominal organs are entering into the thorax and thus they cause obstruction, and because of many organs in the thorax, the organs are compressed against each other. So because of the compression, the blood supply will be compromised, resulting in incarceration and strangulation of abdominal organs. A transabdominal route is a preferred route of Transabdominal route is preferred choice for Morgagnian hernias, and prosthetic mesh should be put. A prosthetic mesh should be done. Is required to repair the defect. We should put a prosthetic mesh so that the contents from the abdomen do not reach the thorax, or there is no recurrence of the defect.
thank you and thank you for watching.